Today we're going to talk about form and force closure assessments about the SIJ and pelvis. And so for that we have two tests that we typically look at. One is a little bit better in terms of the evidence that supports its use. The other one, we need to be a little bit more cautious in terms of extrapolating the findings. These are the active straight leg raise and the reverse straight leg raise assessments. So let's go ahead and get started. To begin with, we need our patient in a supine position for the active straight leg raise. This is a two-part test, and I'm going to talk through it first and then we'll complete it. So the very first part is you would ask your patient to perform the active straight leg raise, lifting the leg up, all right? If they can do it, the test is done. It's considered that the patient has the ability to control that. They have adequate proximal stabilization technique. Certainly there may be some areas that can still be improved, but that is the conclusion of the test. It becomes a two-part test if they're unable to perform it initially, and then you're going to come in and you're going to, in essence, seek to enhance the form closure of the pelvis and the SIJ, thereby giving an added sensory input and perhaps improving their perception of stability. If they then can perform the test with that extra bit of assistance, the test is considered positive. So let's go ahead and walk through what this would look like. Go ahead and keep the entire leg straight and lift it up off the table to my hand. Perfect. Now, there's not a defined height. I typically give them about 60 to 70 degrees. I have them hold for a second and then we bring it back down. We can complete that on the opposite side as well. However, let's assume that in this case we asked our patient to perform this test and they were unable to do it. Here's the second part. What you're going to do is you're going to palpate the ASIS and the iliac crest of either side of the pelvis, and you're going to provide about 45 degrees compressive force on either side. You're then going to ask the patient to reaccomplish that active straight leg raise, and so it would look like this. Go ahead and lift that leg back up, perfect, hold, and then come back down. Now, 2 points that I should note. One, you'll note I'm on the opposite side of the patient so that my body position doesn't block them from coming into that hip flexion posture. The second piece, anytime we start to get around the pelvis and the SI region, you need to be mindful that you're in an area that is a more personal space for your patient. And so it would not be appropriate to perform this test as such, right? Doing so means if you were going to perform it on the other side, you would need to move to the opposite side of the table and vice versa. Now, the second part of this test is the reverse straight leg raise. Now, the reverse straight leg raise does not have as much evidence supporting its use, so again, proceed with caution here. For this, we need our patient to come onto their stomach, so into a prone position. The initial part is the exact same. We're going to ask them to try to keep the leg straight and to initiate a reverse straight leg raise. Excellent. If this was our patient, they were able to do this, they were able to hold that, we would consider the test finished at that point. However, let's assume that they're unable to do this. The next steps are the exact same. You're going to come in, instead of finding the ASIS, now you're just looking for the iliac crest, and you're going to provide that force and then ask them to do it again. Fantastic. Okay. If they can do it in that position, again, the idea is that you are enhancing that form closure. There is, however, a third variation that's been proposed, and that is if they're still unable to do it, a proposed crossing pattern or kind of a sling, if you will, through the posterior portion here has been proposed, where you would ask the individual to extend their arm in front of them. They're going to medially rotate into kind of a thumb down position, and then while they extend this arm, you're going to provide a little bit of overpressure and then ask them to try to perform that test again. And at this point, again, the idea is that you're kind of getting at this idea of reciprocity, right? Go ahead and relax. So again, this test has a slightly different nuance to it because there is this third component. Again, unfortunately, the evidence is not as strong for this as it is for the active straight leg raise test. A review in 2015 by Paulson found that the use of hypertonic solution in order to, in essence, kind of make the pain sensitivity a little bit higher in and around the SIJ, did have an altered response with the active straight leg raise test. So we know there is some evidence to support its use in patients dealing with acute and even persistent SIJ related pain. So again, active straight leg raise and reverse straight leg raise, have a go with a peer or colleague. Let me know if there's any questions.